he should have possessed from India, being a member of the Medical Council of India. He should have been registered to the Medical Council of India, I think, or the local, the South Indian or the Tamil Nadu Medical Council. So he might have all those degrees and all. I'm not challenging those. The second thing is, what is being a plastic surgeon, primarily he should have all the skills of a maxillofacial surgeon primarily first. Second is like what he's doing and boasting of his 99.99% plastic surgery, and he's like remodeling. He's just like giving it a new look, a kind of twist, and snatching and grabbing money unnecessarily by using concepts which are totally against medical practices. The number of surgery per day, the number of surgeries he's doing per day, that is also exceeding the standard recommended for a surgeon. Okay, at least a surgeon should have 3 maximum, without any kind of emergency, 3 to 4 surgeries are permitted for a surgeon, and he is doing n number of surgeries per day, like 8 to 7. जैसे काटते हैं ना, गधे को काटते, घोड़े को काटते, काट दो, मतलब कोई दिक्कत नहीं है, just cut open. I kind of like can't express what he is, some kind of like psychedelic guy, or like is he getting some kind of like, he's passionate about doing all these things, that I know, that I can understand. Obviously a guy who is like running 24/7 and doing n number of surgeries per day, and like he's not having a single in that particular perspective I have respect for him, because like he's not sitting in a particular position for a second also. He's so busy with his own surgeries, his like chit chat sessions, his like expressions. The main thing is his communication, right? And his cameraman and his like foreground, the background, everything should be properly balanced, matched up. It's like the attitude is totally professional. But the main thing you guys are not visualizing is the truth behind everything, the amenities behind everything, the practices he is doing. What are the truths? I will show each and every point, what all things he is doing which is totally against standard medical practices, and being a medical practitioner he cannot suggest you to do all these things without having a proper analysis. So what all things I have discussed till time? First thing, I was not at Richardson's hospital for a plastic surgery. First point. If you guys like at least try to understand the current condition, what I'm here for, this channel is for, this is totally for awareness, it's non-profit channel, no need to subscribe, nothing. It's just for an awareness that I am like bringing before you guys this particular facts, what you should know and what will somehow cater to your well-being in near future, and at least it should secure you from going for unnecessary surgeries or any other plastic surgeons, or don't go for any kind of cosmetic surgeries if it's not, at least if you're, it's desired thing, if it's a huge deformity, then only go for plastic surgery. Otherwise not. It's not required, it's not necessary. It will have n number of impact to your whole body, trust me. Starting right from your neurological branching, starting right from your neuromuscular the dependencies, the attachment you have, the kind of mobility you have in your body, in your neck primarily. You can have a wrong jaw relation, a wrong bite relation can lead to several other diseases. You can have Parkinson's, you can have Alzheimer's, you can have n number of things that I will discuss later on. But first I am trying to establish a relationship between the medical terms, the do's and don'ts, and what I was there for at that particular hospital, and what he has done to me. Okay, so that's my basic topic, and what all malpractices he is doing to several other patients whose videos I have been seeing since a long time. So this is my third video in my channel. So it's been a long time since I have not posted any videos. So today I am not with a camera, I'm not showing me, but hopefully I am audible. So I will be like showing you all the proofs, why I was there for, what he has done to me, each and everything. So as I was like starting off, let's start off straight with the topic. Now, so this was my face. This was the way I used to smile. This was the head size. I'm bald. Okay, so you can see everything. Okay, this is my side profile. This is my front profile, as you can see. Okay, this was the way it was like done. So from this you cannot understand that there was any kind of problem with me. Okay, see. So now what was my problem? Let's discuss. So this was my kind of like profile with beard, without beard, everything I will show you. Okay, one by one. This was the side profile. You can see a long mandible, a long maxilla, matching up to the head size as well. So this was nature's wish. So this was very natural. Okay, okay. So what my profile was is I've shown everything. So what my problem was, now if I kept my jaw muscles loose, if I just bite, so this was the kind of shape the jaw automatically took. As you can see from here, this side, see there, if I draw a straight line right from the what to say, this particular part, the cheekbone to this, the chin, and from this nose to right in the this side, it's my left side and it's my right side. Okay, so see, this kind of a pseudo open bite kind of a thing. So I will explain it later on. So what my problem was, this was my aesthetic problem. That was that was not a critical, that was not a critical thing. Even if it was not cured or like anything wouldn't have been done on me, still I would have managed this my whole life. Okay, so there was no issue with this, because like there was neuromuscular dependencies, attachments, everything I will discuss. So what my problem was this, okay, aesthetically. Okay, so I was not there even to correct these aesthetical problems of mine. So I will show you first the report of AIMS. Okay, so I have been showing up and following up. I had a childhood trauma when I was like, as I discussed in the first video also, I'll brief that as well. So there was a problem with my, I had a childhood trauma when I was 12, 13 years old. Okay. So like after that, see, so this is a AIMS report I am telling you. Asymmetrical fit, difficulty in breathing, difficulty in breathing and bending also, difficulty in swallowing also, bending down also. And so these were the notes. Okay, lateral cephalogram X-ray was suggested and I have done that. And what all things was like, what all things came out of that was like, is this, yeah, I will show you, this one. Okay, so this was the thing which what came out of that. So over here it's clearly written, it's a class 3 skeletal open bite. Okay, trauma at the age of side face 12 years ago. So this was totally a skeletal class 3 open bite I had. That is not a, now what is a skeletal open bite and what is a normal, like what to say, a normal dental open bite, means like a normal teeth level open bite, molar open bite, the normal what to say, skeletal open bite and the normal occlusional open bite, means like just in the teeth due to childhood deformities, it might be due to the way you are born, might be. So that is totally different. Okay, so we'll discuss accordingly. So skeletal open bite only arises when you are having some kind of childhood trauma and you have some skeletal injuries first. Okay, it's so 90% of the dental surgeons or even the dentist, I don't know what kind of like institutes they have been passing out from, they don't have this particular difference. They know what is skeletal open bite means. You will have a prognathic mandible, means like forward anterior open bite होगा आपका और आपका नीचे वाला jaw जो होगा mandible जो होगा, it will be forward, and that kind of occlusion if you have, that's a skeletal open bite. अरे skeletal open bite has been termed specifically if you are having a skeletal deformity, and due to that your bite is either anteriorly positioned or posteriorly positioned, your bite is not matching up, you cannot chew. It might be anterior, it might be cross, it might be anything, but all those terms will be like a skeletal open bite or a skeletal cross bite. Because due to a skeletal trauma or injury, that particular teeth or the set of teeth has been impacted since that particular trauma has been in childhood span of time. So like in the span of time while a person grows up, it leads to a n number of other deformities as well. Now what are related to a skeletal open bite? Let's tell you. As you can see, from this picture, when I am stretching my muscles, then it's looking okay, but it's the chin angle will be downward and backward, okay, and the whole mandible will be set back, okay, as this is due to like your growth. As I said before, if you're having a skeletal open bite, the set of teeth, and majorly a skeletal open bite also has some kind of impact with a joint. What joint? Your temporomandibular joint. That is the main thing, the main part a person is having issues with during skeletal open bite or anterior cross bite, skeletal anterior open bite or skeletal cross bite, anything, any kind of skeletal trauma if you are having, then first we need to check whether the joints are proper or not, the TMJs are proper or not. Cause due to the growth rate, means like see, if you look carefully from this picture, if you look carefully, this is a joint, okay. So this joint has been grown from a slightly forward and anterior position to this joint, to the right joint. So this was the first diagnosis that a professional medical practitioner should have done. So what my problem was, right now I have all the reports, I will show you everything. Both my joints were being hurt and there is a disc between the condyle and the TMJ. So both the discs were impacted during my childhood trauma, okay. So as I was 12 and 13 years of age, due to the muscle pull and due to the exercise and due to the growth period, one joint was slightly forward than the other joint, means the condylar growth rate were different. One joint was attached to the condyle from some posterior, a bit of posterior side, posterior and outward, okay. The medical term is like, what to say, anterior and like adjacent or posterior or like outward, this kind of an attachment, okay, to this joint. This joint and the mandible growth in left side was forward and straight downward, and from my right TMJ, as you can see, there is a hollowness over here, and this was from behind to match up to the left mandible. Hence there was a like a twisted kind of a face growth. But when I used to open my bite and stretch up my muscles, then due to the musculature, I could hold my face to this particular position to match my lip competency, everything. But due to this problem, I had a habit of tongue thrusting, means placing my tongue between my upper maxilla and my lower mandible to match up, to pull the muscles, or like to place the tongue to match up this particular ratio and then swallow. So this was a natural thing. My body adjusted this way in my growth period. So what, being a medical practitioner, what he should have done? He should have at least told me कि first joint का arthroscopy करवा लो, go for an arthroscopy or go for a lateral TMJ CBCT. And both my joints were, due to this particular like trauma, and like the discs were totally ruptured, and there was only both the joints and the mandibles were totally balanced by the muscle tension, because the discs were very loose and fragile. There was like least contact with the disc. The joints were rubbing each other. The condyle and the TMJ, that the head of the TMJ were rubbing each other. So this was the kind of condition I was having with my joints, and which has led to what I will tell you. As you can see, this whole side was this TMJ and this TMJ. Both TMJ, I can show you the reports where it is clearly written both the TMJs are osteoarthritic. Okay, so osteoarthrosis is there in both the TMJs due to this particular trauma and the growth rate and the use of the growth of the mandible, the way I bite, the way I swallow, everything. And over the years, in the course of years, as this was in my growth period, my right side, the total, all the joints in the right side, starting right from my right shoulder, my right hip, everything was trying to take and match up to that condylar position. Means like what I'm trying to say, it got right. Means what I'm saying is like this joint and this mandible, from the right TMJ, the mandibular growth was like from backward and slightly outward, and then it's matching up to the mandible and this joint, which is growing slightly from a anterior, slightly anterior and outward position relative to this. So matching this posture, dhire dhire over the years during my growth period, my left shoulder, my left hip, everything was slightly placed forward, and the right portion, the right shoulder and the right hip and the ankle, everything was stretched backward. Means the right side, all the joints were relaxing, and the left side, the joint, the shoulder, the hip, everything was totally osteoarthritic. So I had a tremendous neuromuscular and arthritic pain since I grew up. So this was the kind of emergency I had. This was the kind of problems I had, for which I waited for 31 long years, did a lot of research that some doctors might like address me correctly to get it treated, because as I age up, these problems would increase 1,000 folds. So this was my problem. Now, to make it sure that I'm not talking bullshit or I'm not talking anything to pass on camouflaging information, I will show the first chat session with Dr. Sunil Richardson when I pinged him with all the proofs. As you can see, I have attached here all these like pictures along with he is asking only for the pictures. Okay, he is only asking for the pictures. So I attached pictures as well as this AIMS report, all the doctors I have been visiting since my childhood. Then I strictly mentioned, as you can see, DSI discussed, these are my current facial peak, keeping my jaw muscles loose, and few reports for reference from AIMS where I consulted few years back. It has severely impacted my posture, cervical, lumbar and hips as well, 24/7 rigidity, pain as well as imbalance in my whole body. Left and right parts are totally out of sync. After sending all this, Dr. Sunil Richardson here, and straight saying this particular without having a look at the prescriptions from AIMS and other hospitals, straightway he just writes down or puts down, jots down, he can correct this, no issues. 7 days stay needed, another 2 weeks re-establishment or something like that, rest and all. Richardson's Dental and Craniofacial Hospital, and just looking at the picture, he gives an estimate like 1.5 to 2 lakhs. Oh my God, really he is a god. I thought, obviously, just looking at a picture, after writing everything and sharing this kind of severe reports with him, that what my exact problem is, what I'm seeking for, he's just showing super confidence. No other doctor in this whole universe has shown me this kind of confidence before. So obviously, being a patient, what to do? And I was suffering tremendous pain since my childhood. So what should I do? I thought he's a god doctor, he can correct anything. Means like such confidence I've never seen. At that point of time, who thought that this would be the result, and this would end up everything, at least all those qualities I was possessing without going for a surgery and without before getting a surgery done. I could have stretched my whole life that way. Pain was there, but at least I was able to sit in a particular position for at least 8 hours, 10 hours. I used to walk normally, I used to speak normally, I used to drink normally. There was no pain, irritation. When I used to rest, at least I slept. And for the last 1.5 years, I'm not able to sleep for a single night. I'm having tremendous intracranial pressure. I will discuss all these points later on. These are the circumstances currently I'm facing, the situation I'm in currently. So, sir, will the process be surgical? Yes, of course. Then, blah, 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 blah. This was the communication. So, I took a loan, I convinced my parents, and I, obviously, such a super confident doc, I visited that particular location. Okay. So, see. And as you can see, this was my childhood photo before the trauma, and there also I had a retrognathic profile only before accident. A big head, but a long mandible, as well as a long maxilla. So these are like, there's no problem. First understand, to all the viewers, there's no problem if you have a long mandible, but a long and strong mandible. If you're having a strong mandible, see, the height of the mandible is more. Okay, this angle should be like this, doctor will tell you. And the chin would meet this particular angle, only a straight line. These are all bullshits I'm telling you. This is totally catering to the ethnicity, the kind of like region or the area, the environment you have been born and brought up. The genetic qualities, everything impacts your activities since your childhood. If you are having enough musculature wala activity, then you will have a strong and broad jaw. And you will have a very good like downward chin, the whole mandible. It's called kind of antiface. Okay. So there is no wrong in this. Aesthetically, I was not there at all. I was only there how to solve my problems. See, this was also my official picture, at least 4 to 5 years back. Same thing. The mandible is long, and the maxilla is also long, head is also big, and it's pointing towards a small and shallow chin, which was kind of making my profile pointy. See, and there's a good mandibular angle also, everything was proper. But only problem was this osteoarthritic wala joint, this mandicondylar growth, and the postural issues I used to face now and then, and the tremendous kind of pain I used to face 24/7. And see, this is a long face also kind of. Okay, so this was due to the growth rate. Obviously, if you are having condylar problem, this will arise, this will happen. So being a doctor, you should have understood all this. So on 13th of March, I took a loan, as I said before, and I visited this doctor, and what it did was like straight away, I can correct everything, no issue, and ठीक है, आपका aesthetics भी ठीक हो जाएगा, everything will be corrected. Okay. So next, what he did, now in my case, there is only one kind of treatment that can be done. Okay. Only you can ask n number of doctors if you have a class 3 skeletal open bite. Okay. What is the treatment? If you are having a problem, then what is the treatment for class 3 skeletal open bite with TMJ issues? If you are having, first there will be TENS therapy on your TMJs or to stabilize the TMJs, and even without stabilizing the TMJs, only there is one way of treatment. That is two ways of treatment. One thing is IVRO, intraoral vertical ramus osteotomy. That is the most successful treatment plan for anybody who is having TMJ issues. Okay, vertically ramus ko cut karke, then it is left to automatically remodel so that the TMJ pressures or the TMJ position or any damage to the cartilage or the discs are healed and the TMJs are restored. Then if you are having any kind of deformity, then we can go for any cosmetic surgery to correct that. So this can be done, and the majorly accepted and the only way to correct my problem was BSSO, bilateral sagittal split osteotomy, along with a Lefort one, means like cutting the maxilla, bringing it forward and downward, and then again as the growth was from beyond, and like you have to match up the growth, so like cut both the ramus, splitting down the ramus, not vertically but horizontally, just like a sagittal area split, and bringing it forward and like downward, and there was no requirement of any kind of genioplasty or jaw sculpting or anything was not required. Everything was pretty much fine, as you can see. Even the lip competencies were also proper. Now this doctor, what he does, even he convinced my father and before me also, it's like he was super confident. He just having a glance, I can correct each and everything, no matter what. Then he is telling, usi din, the 13th of March, I remember 2021, I went to his clinic for having a consultation as well as surgery. So he told that no issue, I can correct each and everything. So you can go for the surgery. Today only we can do the surgery. Okay, so I discussed with my father ki like I was suffering this pain and everything so since long. So chalo, agar he's like giving us enough amount of confidence that he can correct it and he can go ahead with the surgery today itself, then let's go for the surgery, no matter what. He's showing tremendous amount of confidence. That would be like, seriously, that might bring a good result, right? So, so this was the thing. So after, when I woke up from the surgery, I found out like what happened, like totally a different broad kind of a chin, face was long, my teeth exposure was changed, it was a lot of swelling, and there was anesthesia, the effect of anesthesia was also very high. So like at that point of time I asked myself like, there's no kind of like sagittal split has been done. I could feel like he didn't touch my maxilla, upper maxilla, nothing. Only there was swelling in my like side areas, I mean like jaw sculpting he has done, a genioplasty he has done out of nothing. Okay, so this is the thing he has done, medical negligence number 2. Without even letting me know what kind of procedures he will do. Okay, so after that, discharge certificate body is like writing, see, diagnosis, dearranged occlusions, history, patient complaints of clicking sound while chewing. History, patient clicking sound while chewing. Now, if I consider that he writes this also, obviously, even if I complain clicking sound while chewing, the first thing, being a doctor, what should he do? He should give a TMJ scan or some kind of, he should first understand what is the dependency with my TMJ. Clinical examination is something different. Facial asymmetry is a clinical examination. Class 3, skeletal open bite. It was not a class 3 molar occlusion. Anterior open bite, and that was skeletal. As per the report shared to him all primarily by AIMS. Everything was clear. And procedures, what was done? Lower jaw surgery and mandibular osteoplasty. Now, if I only show this particular discharge summary to any of the medical councils, his license will be cancelled. Patient diagnosis, dearranged occlusion, patient's complaints of clicking sound while chewing, facial asymmetry, class 3 molar occlusion, anterior open bite. Okay, and the treatment is mandibular osteoplasty for anterior open bite. And lower jaw surgery means what he has done I can show from the scans. Now let's open the scans, open up the scans. Even he and his team does a tremendous job in hiding the scans and the detailed, like most of the cases, in my case, second time when I visited the hospital, the first after my surgery, the doctor was running here, he was like very busy, and even the discharge summary, the CD, CBCT CDs, everything was shared to me after I returned back to my hometown. And prior to that, nothing was shared, and the doctor wouldn't even give me a visit. I would explain me some showing the CBCT scans that this is the things, blah blah things has been done to you, because he also knows. Now we'll straight away come to the scan. Again, the third and the Third point, medical negligence. How he treats his patients and what all malpractice and what all what to say. Means criminal activities, criminal offenses he does with his patients. I will show you. So before surgery, I will show my pictures. Okay. So before surgery, you can see I'm showing you just the pictures because I am having the software. I can show you from the softwares just the way he shows. I can compare you also just the way he shows. I can show each and every angle, inch of like sculpting, everything. What all he has done, I can show you. That will come up in a separate video if you want. I can like show you guys from the software. But these are all the angular snaps. I have already taken it. Okay. So this was the kind of jaw I had. Can you see any kind of problems with the growth rate or the density or anything? Nothing, right? Only thing was that it's see the placement of this is this particular condyle, the joint, and see the placement of this joint. See, okay, and see this angle, okay. It's somehow it's not captured because the light is not equally going to both sides. As I said, this is the left side, okay. The left side is forward, anterior and forwardly placed, and this is the right side. It's backwardly placed, and this joint, it's fused. It's with fused and inside. So this particular during the X-ray, this hinge kind of a thing, this particular part is there, but it's not showing up in the scan. But this same part is there. I will show you from the CBCT image. Then you would better have a better understanding to it, right? And this is the skeletal class 3 anterior open bite. It's a class 3 anterior open bite only. Front teeth are not touching, and it's anteriorly not touching, and it's a skeletal one because I have a issue with the TMJ. Okay, clear? Second C, a strong and long and properly angulated. There is no deformity with the mandibular growth. There is no deformity. Only there is a deformity from the condylar growth. Means like this joint, there is a deformity starting right from this joint. Only this ramus height or the ramus width from one side to the other side. Okay. There is no problem with the chin, as you can see. It's a wonderfully designed, natured designed chin. It's having a proper curve. See, this is called skeletal anterior open bite, okay. But the midline, see the midline, see, it was totally straight and proper. There was no problem with the midline as well. There was no asymmetry with the midline, as you can see, okay. So he has like in his diagnosis there was asymmetry, but it was not an asymmetry. It was something different. It was something else. Now my side views before surgery I am talking about. These are all before surgical pictures I am sharing with you guys. See this angle, it's showing up a beautiful pointed chin and everything is proper. Only this teeth size, see this teeth size, it is also long and large, okay. So to match up I have a big head, a big mandible, a big maxilla is required. A strong mandible is required. So that's why the mandible is strong enough and pointed enough, long enough, okay, to accommodate this kind of teeth structure. See both sides, see the kind of angle, the kind of everything is proper. There's no issue with anything. See the kind of angle I had. Now in the name of jaw surgery or whatsoever, what he has done I will show you. Now when I woke up, I found out that he has done something. When I received the DVD, I found out that he has done something like this. Now tell me, what are you seeing any kind of improvement with the kind of occlusion I have had, the skeletal open bite, or any kind of condylar position? See anything, any improvement, anything? No. He totally mismanipulated, exploited me, and he did something which is unnecessary. See the bone density. I had a strong, long chin bone. Okay, he did unnecessary osteoplasty. Means like osteoplasty means like you just sculpted it all, contoured it all over here, which is also uneven. See, this side more contouring, this side is less contouring. Okay, and this is my chin. Now say, was I there for getting this kind of a chin, or this imbalance kind of a contouring? Was this my motto, to achieve this after the surgery, to spend 2 to 3 lakhs rupees after the surgery? This was my achievement, as I discussed with you guys since starting right from my video. So was this the thing I should have received from a knowledgeable, the God doc, what all things you might be saying to this doctor? Was it the thing I should have received from this doctor? Now, second thing, the fourth unethical thing, this one is the third unethical practice. I had no requirement of genioplasty or jaw sculpting. I was not at all there for this. Okay, and a person, I will talk about orthotropics also later on in one of any other session, where it's strictly mentioned, or any other, like if you can refer to some dental documents from US or some other countries as well, a person who is having a TMJ kind of osteoarthrosis and having a class 3 skeletal open might have a strong dependency with his chin, the way the chin is positioned, the way the chin is placed, it would be very near to your vocal cord to support your open bite, cause you are not able. आपका पूरा का पूरा जो mandible है, आपका जो teeth set है नीचे वाला, that is anteriorly placed, that is forward and outward, that is an open skeletally, and without correcting it, you cannot touch any of the chin, or like any kind of shaving off, sculpting is strictly against standard medical practice or advice. You can't do so. Now, what else he has done? See, I will be telling you. I can show you with all the proofs. I'll be sharing you. Now see, I will show you the CBCT view. This is the kind of advancement he has done. Genioplasty, ambiguous advancement, 11 millimeters. Who has told him? Who asked him to do such kind of advancement? 11 millimeters advancement, vertical advancement. Now, can you see this side? There's a cut from this side, which is totally like God knows. Cut from this side, okay, which is up to here, then it's missing, and you can see some kind of like sparkling metal pieces or something like that, which is like over here. Now I will tell, this is called a bad split. He started with a BSSO, but the kind of joint I have, whenever he cut this, I will show you. See, he started cutting this particular bone from the lingual cortex till the buccal cortex. Okay, these are the sides. Okay, from this to this. So when he just started cutting this for splitting sagittally, automatically due to the joint position or the joint stress, the condylar joint, the arthrotic joints, or the kind of joint, the way my joints were placed and positioned, automatically this particular mandal auto-rotated towards the left side. Means what to say, see, this portion yahan tak cut ke, till this particular point he cut it. It's splitted and auto-rotated towards the right. So kind of like, see, it's now a snapped-in kind of a face. The face is no more straight. It has been shifted due to the joint spool in the left side. Because already, as I said before, the left side joint was placed anteriorly and forwardly. Okay, so as it was anteriorly placed, whenever there was a tension release in the right side, automatically the joint in the left side pulled back, and there was an auto rotation with along with the whole mandible, along with the teeth, it auto rotated towards the left side, and hence the whole midline shifted. See how much the midline has shifted. See, the whole midline has shifted. See, the midline should have been this. Now there is a shift of at least 2 to 3 mm or more than that, and chin He has made it a piece of, like, what to say, we can play with it, a piece of like stone or something like that. What he has done with the chin, see, it's of no use, man. In my case, why he should do it, I don't know. It's just looking just like an Egyptian mummy. Who would require a chin like this? Who has told? And unnecessary contouring. See the kind of contouring he has done. I will show you everything. See, this side ज़्यादा contouring हो गया. In my right side, it did a massive contouring. Unnecessary bone density को कम करना. Unnecessary sculpting. And this split, which he hasn't mentioned in any of his OP notes. Even in his OP notes, he is writing he has done genioplasty. Is he an idiot? Is he something? He's like confused, or he's like giving a damn care of what he is writing, what he is doing. I will show the OP notes also. See, in OP notes, it straightway mentioned jaw sculpting with genioplasty. Okay. After that, I questioned him right there. OP note, no, sorry. OP notes also I received when I came back. After the surgery, he didn't see me also. Once in a hurry, he seen me, and just like there were cameramans, and like he posed me, and I was in anesthesia effect. So like what all he has done, I was not able to understand only because my whole face was numb. What all things he was saying, I was just like, ठीक है, तो कर दिया, क्या कर सकते हैं? What is done, like I was like questioning, I was like totally shocked. What he has done? How could he do this? The whole teeth exposure has changed. He has made my face broad. Obviously, if you are splitting is sagittally this way, and there is an auto rotation happening, means this extra amount, at least 6 to 7 millimeters of bone extra has been formed in this particular region. And even he has not done a full split, which is totally a medical. There's no term in medical science to do this kind of operation. One side, जानबूझ के, he has elongated one side, and that too not properly, cause it was a bad split. And this split has not even been mentioned in the OP notes. And now I will tell you another thing which has like ruined my life till this particular date. See, you can see some metals over here, and this one, I will zoom. See this one. See this one, okay. Now I have got all these things removed, okay. Majorly this one and this two. These are simple ligature wears. At least, even if you would have, it might happen, accidents might happen. Being a doctor, if you couldn't like judge properly, there might be a mishappening that might occur during surgery. At least he should have like pushed it back again and set it with a permanent titanium plate this side, if he's not sure what he has done. But to my surprise, he left it this way only, and then just tied this particular portion with a ligature wear, which is prone to infection, which is prone to like any kind of infection. And this too a ligature wear. And this piece, you'll be surprised, this is a piece of a burr which somehow broke, and it was kept inside my mandible. It's just an alloy, okay. This piece of burr is just an alloy, okay. This one, just like a screwdriver or anything, which runs in a motion, to and fro motion, oscillates like, okay, like able to cut your jaw. So this is a piece of burr. I will attach all the pictures of this particular elements also, what all things has been removed, okay, from my face. I have kept everything with me. So this is a piece of burr which is highly infectious, and it was broken and left inside my jaw. And these things were not even mentioned in his OP note. What the procedure is also not clear, and these things, such a negligent doctor, these things, well, a piece of burr was left inside my jaw, and he is putting damn care about it. And right now he has blocked me from all of his contacts so that I cannot reach him. Now you guys tell me how ethical this doctor is and how he's portraying him. And just in my case, just let me know. And cosmetic surgery and the after side effects and the consequences it might lead to, these are tremendous, I'm telling you. You can have infections running through your whole body, okay. After that, what I have faced and what I am facing till date, I will share you. I am having severe like muscle tensions while I speak, while I talk, while I sit. My whole posture has been changed to backward posture. It's like I cannot bend down, not even my shoulder, and there's a huge cervical impaction after this auto rotation kind of a movement. Okay, obviously one side you are moving without any kind of plan, and you are like leaving some foreign particles, and that kind of infection means like I was not able to focus on anything, and even now also my eyesight is almost gone. I'm seeing everything blurry. Tremendous impact on the optic nerve, the trigeminal nerves on your face due to the infections. I'm kind of having, at this point of time, I'm having a stage 1 precancerous kind of like submucosal fibrosis, which might lead to cancer. Now see, what all misethical or medical negligent based cases or practices can lead to. And I am in 24/7, I am not having any kind of hunger, appetite towards any kind of food. I am just surviving myself. I'm just having some kind of food to just have my living. Whenever in a day I at least eat once, I think so. My tummy is always stretched, it's always bloated due to the infections that are spread since this long number of days, since a long time span of 1 or 1 year plus. So I'm suffering from all these conditions. I'm having infections in other organs also. This might lead to cancer and finally fatal death also. So see, this is the kind of treatment and services this doctor and this hospital is providing to, like, what to say? First, no diagnosis, wrong treatment. Second, negligences, malpractices. I don't know why you guys are approaching this guy and why you guys are not questioning yourselves. This guy is simply portraying or getting some kind of like introducing some kinds of terms and terminologies which is not so popular in Indian culture, in our Indian society, which was not discussed years back. Now he's discussing all those terms and technologies and like showing up, empowering you guys so that you are like highly manipulated and like get addicted towards changing yourselves. He doesn't have any kind of idea about the jaw, phi, the golden ratio, the kind of ethnicities, the variety of face proportions, who will suit what will suit whom. He is just doing something which is fitting his own bullshit kind of a mind, and he is just a manipulator, a communicator. I am telling you, don't go get too deep in his words, otherwise your lives will be ruined. I am telling you. छोटे छोटे चीजें, how you blow, how you there are n number of muscles in my face also, tissues, subcutaneous tissues are there, muscles are there. The infrahyoid muscles are supplying the gastrointestinal channels also. If there is it's stretched up, you will be bloated. You will lose your appetite. You can't walk, stand properly. If it's affecting any kind of your optic nerves or any of the trigeminal nerves, you will lose some kind of body balance. Unnecessary shaving off. If there is an imbalance in your buccal cortex also, you will have some kind of like imbalance in your muscle pool also, right? So try to think yourselves. Don't just go by the words of this cunning doctor. He's just looting you guys and he's trying to make his own area or the what all Nagarcoil or whatsoever where he belongs to. He's just trying to empower his region, his men, and that particular, and he's having some kind of political holdout also there, being some kind of like member to any of the societies. I don't know, I have no idea to that. But this is, end of the day, this is impact, this is due to your money, hard-earned money, and it's impacting lives of millions and lakhs of people of India who are not aware about these particular constraints, who are not aware about what to do, what not to do. They're simply getting convinced by his words, and they're going and wasting their money for nothing. And treatment, Bhagwan na kare aap logo ke saath aisa ho. Treatment, if you need treatment necessary, which is ultimate or penultimate treatment you need, then never go to this kind of doctors. At least Sunil Richardson के पास तो जाना ही नहीं है, hospital में जाना ही नहीं है. At least this is clear from my case. I have what all things I have shown you. So So this is the final result. All the things I have shown you. What kind of treatment, what kind of practices he has done with me, what has done to me. I can see now. This is the OP note. I will show you the OP note also. Shanik Chaudhary, OP number this one, 31 years male. IP number this one. Samir Ranjan Chaudhary is my father's name. Okay, J29 Sagarbanga Colony. History by Dr. Sunil Richardson. No history of AIMS. He has not mentioned anything which has been shared by me. He has done everything by a free software what he is using, where it is strictly written. The software is capturing the images with the Sirona Dentsply or something like that. It's strictly written in that particular software's advisory. That is not for medical, any kind of standard medical practices. So class 3 molar relation. It's not class 3 molar relation. It's it will be like class 3 skeletal malocclusion. Facial asymmetry, obviously due to the condylar growth. Okay. So now this has the thing. This is his diagnosis. Augmentation ato said half before surgery. Okay, augmenting. This is the medications and all. Now come to the procedure. Just hold on. These are the procedures. See. Intubation, throat, intubated patient throat. Acha. See, genioplasty, horizontal plus vertical advancement. See how unethical. Over here he is writing genioplasty, horizontal and vertical augmentation. Simple. Nothing else has been done. Findings and patient intubated and other. Only procedure, operation. What is the operation's name? Genioplasty, horizontal plus vertical advancement. And in the discharge, what he has written? This is the OP note, means this is the most serious note. Any insurance company or any of the insurance companies or any of the doctors, if you file a case, even this is the main thing that will be required. Live at that point of time, live during the surgery, what he has done. So I told you what my case was, what I was there for. Now see his OP notes, what he has done. Straight way, दिल का सच्चा लिख दिया, genioplasty करके छोड़ दिया. Time नहीं है ना. I have to do 8 to 10 surgeries per day. So I have to show that kind of a vigor within me. I should carry that vigor. What I am doing and what I am doing to that particular patient's life, I shouldn't be bothered about it. I should at least bother about it, right? So this is the kind of doctor he is. Now, see the discharge. I have shown you already the discharge. And discharge is mentioning patient complaints of clicking sound while chewing. Facial asymmetry class 3 molar, lower jaw surgery and mandibular osteoplasty. Totally different. Only in the reports and the scans only I am showing you that how varying this person can be. How fake this person can be. I am just showing you live in this session. Jago grahak jago. Try to understand, try and understand. It's an eye opener for you. I would request each one of you to join me for this cause and sue this doctor so his license gets cancelled and this hospital has a stake to all its what all things it has done to several other patients. This hospital should be closed, and I will pledge before you guys to join me for this cause, please, and save your lives, man. Try to be aware and conscious. I won't be there for the whole life to support and to save you guys. You should be aware. You should be आँख कान खोल के करो. जिंदगी में एक गलती किया है to go to this bullshit doctor and I've lost everything. I'm telling you guys, everything. Thank you. Kindly go through the video. There's no profit in showing my face. So this was just a screen sharing session, so that at least you guys have enough kind of clarity what this particular hospital and what this doctor has done to me, what is the reality behind his treatment, behind his beautiful words, camouflaged kind of business policies. This is the reality I'm showing you guys. This is the reality. So thank you, and please don't subscribe my channel. This channel is strictly not for any kind of profit making interest. This is only for activism and public awareness, so that the thing which has happened to me, the scenarios which I've been facing through, I've been going through since last 1.5 years or so, You guys don't have to suffer that. At least that would be my request. At least question yourself if this video is at least contributing 10%, 20% in the total like field of what all maxillofacial procedures or what all things you are interested to do in terms of plastic, cosmetic, maxillofacial, craniofacial surgeries. At least if this video helps you, this session helps you to gain a 10%, 20% awareness, it will be my achievement. That's it. Nothing else. Please. Thank you.